and you must all know about this golden proportion. One of the problems with orthodontic surgery or aesthetic procedures is how do you standardize or quantify beauty or aesthetics? That's one of the difficult issues we have. And all these photographs, all of them, are really beautiful faces. Do they all have the same proportions? All of them look different. And those values, the literature that you see on the left are supposed to be, some people believe those are the signs of a very aesthetic or a beautiful face. We all know that the beauty varies from person to person, from race to race, and we say that beauty lies in the no use, because as a surgeon, your aesthetics or how you're going to manage that patient face, suppose somebody else doesn't like it, what do you do? So that's one of the great difficulties with aesthetics and treatment planning, because when you're planning orthodontic surgery, especially with cephalometrics, all this, you believe that the cranial part is normal, and you're trying to relate the maxilla and the mandible towards the normal cranium. So if the cranial part is not normal, all these things will go away. So, and you are not going to change the width of the face. There are a lot of things you're not going to work on. Usual orthodontic surgery is essentially you're going to move the maxilla, mandible, anteriorly, posteriorly, sideways, and all that, and you're trying to get as much of proportions right as possible. You get it? So the options you have is limited. Somebody who is not very fair or the skin is very coarse, those are all issues. What you're going to do is that you're trying to alter the skeleton for framework and try to achieve an acceptable aesthetics. The aesthetics that you decide for the patient might not be what the patient wants. That is again one of the advantages of PSP, because you can show the patient how the changes are going to work. I'm sure you must be familiar with the golden proportions, and artists have been trying to use it to define and achieve beauty based on the golden proportions. Essentially, important to listen to the patient's concerns and plan the treatment with mutual agreement, because you might want to have the patient to have a better chin, but the patient will be worried only about getting a good bite or good function. So you need to, each treatment plan is custom made for the individual patient. So you cannot generalize. You cannot generalize saying that a mandibular congratism, I'm going to set the mandible back and get your occlusion right, the patient will be happy. Suppose the maxilla is improved, there's a problem with the bite. All these are issues. You need to sit and talk to the patient and then decide on mutual agreement. Why do you need other specialists? You need orthodontists, you need to discuss with them. And any patient, before you start, you have to decide whether the patient is fit for any medical procedure, that is fit for surgery. You might need to bring in other consultants. We have situations where we have planned the surgery, and just before surgery, suddenly realize that the patient had a cardiac murmur. So you know that some of people have murmur without any issues, but the anesthetist wanted a consent from the patient, high risk consent, because the patient had a cardiac murmur. So any patient you plan to take up for surgery, make sure that you send them on for a medical consultation and get all these things sorted, because you don't want problems once you've sitting under 4 extractions, retraction, everything done, you plan come to the surgery table, you realize the patient has a medical problem which you never realized. Because the patient never knew, he never told you that she never told you that he had any problem. So it's important to get other specialists involved in this. And difficult intubations, always talk to the consultants. It's not just because surgery, go to the anesthetist and say, this patient, I need this intubation or that intubation. Okay? So you need to talk to them before that. Maybe you would want an ENT surgeon to have a look at it, see if the patency of the nails and the nasal passages before he puts in ET tube. So all these are all issues you should consider in your treatment plan. Even if you don't know all these things, few years into practice, you will learn all these things. So don't worry about it. What we are worried about is that your exams coming in, so you should know the basic theory regarding the treatment plan. Basically, the objectives are function, aesthetics, and of course, stability of the results that you get. So, I'm sure you should all learn to draw this diagram, the envelope of discrepancy by profit. Yeah, you would have seen there are some additions in this. We have added the distraction also into it. Okay, so you need to learn how to draw this diagram because it shows how much of movement you get with orthodontics, you get with mind function as well as with the distraction and all osteotomies. Different procedures, you have to understand the different procedures and its limitations. Because when you plan anything, you should know what tools you have. So you should know what are the procedures at your this thing. So you should have an idea about different procedures and what are the movements you can achieve with them. That is also important. So these are all things I think you have gone through. I think osteotomies have been taken from you. Okay. I'm not doing the details, but again, remember you can have combinations. You can have football and anteromaxillary osteotomy and BSSO. Then anteromaxillary distraction used for the cleft patients. Because why? Because you try to move the maxilla and go forward, what would happen? Speech will get disturbed. Okay? So subclavian osteotomies, vertical ramus osteotomies. In our days, it's an external procedure and we can do this intraorally using saws. Inverted osteotomies in syndromes and all, and the mandible is severely very small mandible. You need to move forward. You can place this inverted osteotomy, place grafts in between. Genioplasty helps you to do it in all three movements are possible with genioplasties, and we have a extended sliding genioplasty also, which is useful when facial asymmetry cases. Now let's come to the patient evaluation. I told you regarding the importance of medical history, dental evaluation, and you need to consider about the periodontics as well as the occlusal oral function evaluation. It is very important to make sure that the patients undergo psychological evaluation also, because sometimes the patients are not very happy with the results that you give. So you need to understand if their expectations from the procedure are not normal, because they expect their face to look like somebody else once the procedure is done. Then again, that is an issue. Or their demands regarding how their face should be after the procedure, if their demands are too high, sometimes you will not be able to satisfy. Like I said, you have a basic structure in which you can move few parts here and there. So the result that you can achieve with it is limited. You are trying to achieve the best possible limitations by achieving proper proportions and movements anteroposteriorly or transversely to get the maximum out of it. Aesthetic facial evaluation would include a frontal analysis as well as a profile analysis. Radiographs, what are the usual radiographs that you take?
Lateral surface.
PSL. PSL especially when there's a SL. Okay. Then occlusion and importance of study models, you will take at least 3 sets. And you should have, from the beginning when the patient came, that time you should have study models of that, because after this orthodontic treatment there will be some changes. So you always have these, store all these things and keep it there. So occlusion and study cast evaluation, you understand a lot of things about rotations, teeth rotations, and interarch relationship, all these things you get to know from the cast. TMJ evaluation is important, right? Because the procedure that you do can affect the TMJ. Most important step is the aesthetic evaluation of the patient, because that is the most important step. And it should run a natural head position. How do you get a natural head position right? You should know about the clinical horizontal plane. Okay? That you should be parallel to the floor, and the patient should be sitting looking forward. So that's important. Bind between the usage should be in circulation. Relaxed sleep posture is also important. Proper examination, we are familiar with this. We are looking for the ratio, vertical height to the bizygomatic width, and bigonial will be another 70% less than this. Deposition, full smile, normal, and repose it be 1 to 3 mm of visibility of the teeth is acceptable. Okay? Again, it's smile, but you should always remember that hyperactivity of the levator muscles can affect all this. It is not enough to say that when the patient smiles, it is because of whether it is because of short upper lip or whether it is because of the hyperactivity of the lips. It's important for you to understand that. Assessment is usually done with the lips in repose. Okay? Vertical axis, I was trying to tell you, could be because of short upper lip but one thing you should always remember that even if the lips are short, there is nothing much you can do about it. So we'll have to take as the vertical axis and you will have to manage it. Understand? You will not be able to, how will you manage hyperactive levator muscle? Botox. We give 6 months. 3 to 6 months. Okay? So sometimes some things are difficult to manage. Rule of threes, you're all familiar with it? You know the rule of threes and rule of fifths. Proportions. Proportions are important, right? So it will let you know where the problem is. That is why it's important to know these proportions. All this is there in the theory that they will given to you. So I'm not going to take details. You are aware of this. You are aware of rule of fifths, rule of thirds, then subnasal perpendicular. Subnasal perpendicular we use because N perpendicular uses subnasal. In the soft tissue you use a subnasal perpendicular. And based on how that is a clinical FH plane. Okay, triggers to inferior wall of the orbit, and that should be pyramidal floor. Okay, how the upper lip and lower lip are touching the normal values. Again, nasolabial angle is also important. Acute nasolabial angle means either it is a maxilla is forward or the angulation of the teeth are labially properly. So both reasons you can have an acute nasolabial angle. So in cases where there is a maxillary prognathosum, you would find that there is a nasolabial angle is acute. Then aesthetic lines, there are 3 aesthetic lines. Here I have just quoted one. It is aesthetic line. Basically, how the lips relate to that line will give you a general idea about the soft tissue nature of in the profile. See the last photo, how short it is. So there is a patient who had this cleft lip and palate repair. So she finally underwent the anterior maxillary distraction later on. Labial mental fold is very important. That's why sometimes you do geoplasty so that you get a good labial mental fold. It adds beauty to and the chin, definition to the chin. Projection of the nose, it's important. Some procedures like Leaford 1, you intrude if you vertically you intrude the maxilla in Leaford 1, you end up with a flare-based flaring. So even though there are steps to control it, what are the steps to control it? Sync and pyroplasty. Okay. And you have to understand that it is important that, so you need to measure it. Suppose the patient who is already wide in the LR base, you should warn the patient regarding this. Okay? Because this, say, whatever plastic and all you do, it all depends on how much space is there above the incisors. If there is not much space above the incisors, you will not be able to do a pyroplasty. You understand? So that is why digital scans are important nowadays. Occlusal relationship, you all know the ambulance relationship, as well as bite problems, then you look for curve of speed, all these things from the cast. It's actually important for you to have the cast. Model analysis, these are some of the model analysis that has been described. Your orthodontist friends will help you with this. Learn from them how they do it. Model analysis and all that is important. Okay? Now, coming to the elephant in the room, this is a problem. Supplementrics. Do you know how to draw all these things? Supplementrics. Which article do you follow? Supplementrics for? Orthodontic surgery, Burstone's analysis. Okay. Now, Is it important? It is important. Why? Because it gives you an idea. It's a lateral picture anyway. One of the first things you should remember if you're planning to do a cephalometrics is that you need to understand if the cranial base is right. If the cranial base is not right, there's no point in looking into the cephalometrics. So what do you look at the cranial base? You're looking for the length of the cranial base as well as the flexion of the cranial base. The angle basically to SM. That angle, that is what you look for, and also the length of the cranial base. If it is less, you should make, when you take the other values also, you should take that into consideration. So a normal skull base, and if you are relating the maxilla and mandible to that, what's one important thing that you should realize with cephalometrics. Okay? I'm not going into the details. I'll show you a short video on how we do this cephalometric prediction racing. Have you already done this? Knowledge? Yeah. A small thing you can do with the lateral ceph.